Good evening and thanks very much for joining us. I'm Brittany Ramsey. We begin tonight with some welcomed news as the rollout for the Thunder Bay District Health Unit's mass immunization clinic at the CLE grounds has been announced. People aged 85 and up can get their COVID-19 vaccine as early as Wednesday. Corey Nordstrom has more.
People are ready, people were willing and wanting to get the vaccine, and they were certainly prepared to phone up their local health unit.
And ready they were. Just hours after announcing the first round of mass immunizations at the CLE Coliseum, the Thunder Bay District Health Unit was fully booked for the opening 3 days. All others interested will have to try again next week by visiting the COVID Clinics tab of the Health Unit website or by calling 625-5900. Starting this Wednesday, residents aged 85 and up will begin receiving their first dose of the Pfizer vaccine.
Just because of the group that we're getting in, and also because we are looking to sort of ramp up and figure out our own processes. We're starting off a bit slow right now. It's we aim over 3 days to get around this week to get around 500 people. We're shy of that.
Census data shows that there's roughly 7,000 people in the district in the 85-plus age bracket, though many in the district's long-term care homes would have already been immunized. The health unit is limited by vaccine availability, but plan on ramping up their vaccination rate throughout the week and beyond. Additional staff have already been hired to administer the doses, with the ability to immunize 6 people at a time, and DeMille says an expansion of the CLE clinic is coming.
We've also secured the Heritage Building, which is right beside the Coliseum at the CLE, and we are offering it. You know, that can either support our own immunization activities, or we can set it up for the use of partners.
DeMille was quick to mention Indigenous organizations as her first example of a fitting partner. The health unit plans on setting up an immunization clinic for Indigenous adults in the coming weeks and frontline essential workers in April. Corey Nordstrom, TBT News.
Now, the vaccination news comes as the District Health Unit is reporting another near-record COVID-19 case count today. There are 56 new infections, all in the Thunder Bay area. 31 come from close contact, while the other 25 cases have unknown exposure sources, and none of them are connected to ongoing outbreaks. Today's cases bring the total count to 1,668 since the pandemic began. 376 are considered active, which is a new record. Staffing help is finally on the way for Thunder Bay's COVID-19 isolation centers, which have been struggling to meet human resources demands amid rising case counts. Mayor Bill Morrow says the arrival of 10 to 25 medical professionals and other support staff is imminent. Some may even already be working alongside local St. Joseph's Care Group staff at the isolation centers. The incoming workers are not from Ontario's Emergency Medical Response Team, which is being deployed elsewhere across the province. Instead, they're from Ontario Health North, formerly known as the Northwest LHIN. Morrow says the help was sorely needed. Without it, isolation center staff may have soon had no choice but to turn people away.
That would, of course, been very difficult for those individuals who need the support, but also the pressure then falls on other parts of the community, other agencies, and potentially on the hospital. And so I don't think we can ever underestimate or overestimate, rather, the importance of keeping as many people out of the hospital as we can who maybe don't need a bed in a hospital.
Thunder Bay is also still waiting for more money from the federal government, which is required to continue to operate the isolation centers from April through to September. The Thunder Bay Regional Hospital had to expand its dedicated COVID-19 unit over the weekend in order to handle the increasing number of COVID-positive patients. Today, we caught up with the hospital's chief of staff for an update on their capacity and their ongoing efforts to deal with the virus. Troy Charles has details.
With 29 patients currently admitted with COVID-19 and 10 of those in intensive care, the entire 3A unit of the hospital is now dedicated to COVID care. Hospital Chief of Staff Dr. Zaki Ahmed says with the hospital currently at 81% capacity, they still have some room to work with.
So we have surge plans that take into account what we may need at the worst case scenario. So our COVID unit, for example, currently is we've taken over all of 3A, As the need increases, we have plans to increase it into 3B, and worst case scenario, increase it into 3C as well. So as you can see, we can triple there.
Ahmed says the age of the current COVID patients ranges from people in their 20s to their 80s. He says being in isolation, separated from their families, is very difficult, but the fear of the unknown weighs heaviest on those patients.
I think the biggest thing that COVID patients are worried about right now is fear. So everyone is afraid, as you can imagine. You've just been admitted with COVID. You don't know how you're going to end up. You don't know if you're going to get better or you're going to get worse. And we can't tell you whether you're going to get better or worse. And that's why you're in the hospital. So the fear is by far the number one thing.
The intensive care unit has also been expanded, and when it comes to ventilators, Ahmed says that they have an adequate stockpile and a shortfall is not foreseen. As for those who are fearful about heading to the hospital for urgent non-COVID related care, Ahmed has a message for them.
The hospital is a safe place. So if you have a medical condition that needs urgent attention, please do not hesitate to come into the hospital. We have protocols in place, which will keep you safe from COVID. Just because we have COVID in the hospital does not mean you're going to get it.
Troy Charles, TBT News.
Ontario's long-term care minister, Mary Lee Fullerton, is under fire for failing to publicly voice her concerns about the coronavirus. Newly released transcripts from the province's Commission of Inquiry into Deaths in Senior Care Homes show Fullerton privately expressed fears about the impact of COVID even before the pandemic was declared. Colin DeMello reports.
The Ford government is on the defensive today over the testimony given to the COVID-19 Long-Term Care Commission. We learned that the province did not have an updated pandemic plan, that there were serious concerns within the government about the safety of seniors, leading to critics charging that there was no iron ring around long-term care. When the pandemic arrived on Ontario's doorstep, the province, according to government officials, was not prepared. A senior civil servant told the Long-Term Care Commission last week that he was not aware of there having been a Ministry of Health pandemic response plan. And Ontario's Minister of Health acknowledged that 90% of the province's stockpile of personal protective equipment had spoiled and was destroyed, and the Ford government never replenished it. John Callahan, the Commission's lead counsel, asked, "You do accept that a stockpile should be maintained by the province of Ontario?" Minister Christine Elliott, yes. John Callahan, and exactly who should be responsible for the stockpile? Minister Christine Elliott, that would have been my responsibility.
This government's strategy has been a complete failure. They have been slow to respond to the facts, and this has put the elderly at risk, as well as our frontline care workers.
As COVID began to spread in Ontario, the Ministry of Health took charge, leaving Ontario's Minister of Long-Term Care with serious concerns. Her office expressed fears that they were, quote, the forgotten partner. And as early as February 5th, 2020, the minister's personal notes documented worries of asymptomatic spread. But she told the commission since she was not a public health expert, she didn't want to overstep her authority. Dr. David Williams only acknowledged asymptomatic spread 2 months later in April.
Why was the Premier of our province telling seniors and family members that he had put an iron ring around long-term care, when obviously she was telling him it wasn't the truth?
This was an ongoing effort. We did everything we could. We moved as fast as we could, and we took the advice of the experts and the scientists and our public health experts the whole way along. Thank you.
Critics of the Premier are calling on him to testify in front of the Long-Term Care Commission. The Premier has said in the past that he's willing to do so, but he has yet to be called by the commissioners themselves. At Queen's Park, Colin DeMello, CTV News.
City Council will receive an update from city staff this evening regarding a list of proposals put forward by a local grassroots advocacy group. 3 weeks ago, members of Not One More Death presented several recommendations aimed at helping the homeless and others escape the cold and properly isolate during the pandemic. One recommendation is now being pursued. Norwest Community Health Center, which is funded by the province, has requested money for a free care bus pilot project. The bus would provide transportation to emergency shelters and access to harm reduction and mental health services. Also on tonight's agenda, councillors will vote on whether to join the province's red light camera program. If approved, 10 cameras will be installed around the city in summer of 2022. Drivers caught on camera running a red light would face a $325 fine. The revenue collected by the city should easily pay for the annual $875,000 cost to run the program.
We do expect that we will at least break even on the program, and what we're looking at is any additional revenues we would recommend would be put back into road safety programs.
Councillors will also decide whether to remove 2 Southside traffic lights this year at the corner of Frederica and Brown Streets and the Donald and Vickers Street intersection. Tonight's votes will go ahead without longtime City Councillor Trevor Gertuga. He's announced that he's taking a 2-month leave of absence to deal with health-related matters. The municipality of Oliver Papoonge is receiving over $126,000 combined from Ottawa and the province to refurbish Norwest Arena and 2 community halls. A virtual announcement was held today featuring MP Marcus Pulowski on behalf of the federal government, Parliamentary Assistant Dave Smith on behalf of the provincial government, and Mayor Lucy Kloosterhuis for Oliver Papoonge. The municipality is kicking in $49,000 for its share of the joint funding. The money will pay for interior and exterior upgrades and refurbishments to Norwest Arena. There will also be work done at the Murillo Hall and Roslyn Hall, along with the 2 library hubs. Kloosterhuis says the money has come at the right time for the community centers before the cost of updating them becomes too high.
By investing in municipal infrastructures, both the federal and provincial governments have made a positive difference in the lives of our citizens. Putting people back to work by improving assets that directly serve our communities is one promising strategy enabling the move towards economic recovery from the devastating effects of the pandemic.
Meanwhile, Norwest Arena is also hoping to be the winning entry for this year's Kraft Hockeyville, which includes $250,000 worth of updates. The 3 finalists for that contest will be announced on March 20th. Thunder Bay's Crime Prevention Council is inviting citizens to get involved and have their say in the upcoming Phase 2 public engagement process for community safety and well-being planning. A series of virtual public forums are scheduled to run until March 18th. The free sessions kick off tomorrow night at 6:30 with an information session that will recap findings from Phase 1 and detail the next steps in the planning process. Crime Prevention Council Coordinator Leanne Chevrette is encouraging the public to register on the city's website for one or all of the upcoming virtual consultation sessions.
Yeah, we're hoping that a lot of people in the community will participate and learn where we are in our process for planning this safety plan for the community. And it really is, you know, I would like to say that this really is a community plan. And when we talk about community safety and well-being, this really has to come from the community, not just from one organization or one order of government. This really is a plan that we need the city's collaboration on.
The upcoming sessions will focus on 6 priorities for action, including housing, racism and discrimination, mental well-being, community violence, poverty education, and supports for families. Today marks the start of Lakehead University's Research and Innovation Week, and for the first time in its 16-year history, it's going virtual. The annual conference normally gathers leaders and academics alike for the celebration of new and creative ideas. This year's week-long event will include a variety of online speakers, all related to the theme of Our Changing World. Research and Innovation Vice President Andrew Dean explains why that was an ideal topic for this year.
Living through a global pandemic has radically changed so much of our daily lives. We're living in a different and a disruptive world where we're gathered together from last year's opening ceremonies. We are collectively looking to scientists, political leaders, artists, intellectual thinkers, and knowledge keepers for direction as they work tirelessly to improve health and well-being.
Other events slated for Research and Innovation Week will cover topics like climate change, energy, and Indigenous research.
Well, Fiona, we know there's warmer weather